So as an emergency physician, we need to take care of every patient who comes in. And part of taking care of them is looking up their old records and finding out their medical history. So sometimes those patients who come in aren't really able to provide us with their medical history, and there are a number of reasons for that. They could be unconscious, they could have severe difficulty breathing, they could have difficulty speaking, like in a stroke type situation. They could just have a cognitive deficit, they don't have good healthcare literacy, or they have dementia, or they have a developmental delay. So they're not able to be the source of information. So access to records are important, and if information is not in the current EHR, looking back into legacy data can be really critical. So a good example of that is somebody who comes in with severe shortness of breath. So obviously they're struggling to breathe, and sometimes they have oxygen mask on or a type of ventilation assistance device, so they can't really talk to us. And let's say we do an X-ray and we see abnormal X-ray findings. Well, sometimes the X-ray findings are not conclusive. It could be pneumonia, it could be COVID-19, it could be heart failure or fluid on the lungs. And that one X-ray doesn't tell the whole picture. What really would help us in that situation is access to something like an echocardiogram. So that's an ultrasound of the heart, and people who have heart disease get those periodically, maybe every 6 months, every year. And having access to that one piece of information can dramatically help us care for that patient in the here and now. So if we can get into the legacy data and see what that echocardiogram showed, that would help us differentiate between a heart failure abnormal chest X-ray and a pneumonia or COVID-19 abnormal chest X-ray. And obviously the treatment of those two conditions is very different. I think that's a great example of how just getting one important piece of information from the legacy record dramatically changes how we care for a patient in the here and now.